Despite diet and exercise, are you having trouble controlling your blood sugar? Consider a straightforward beverage that can reduce your fasting blood sugar levels by as much as 10%. Simultaneously promote heart, kidney, and nerve function and lessen post-meal surges. According to U.S. research, some natural treatments can increase insulin sensitivity and reduce HbA1c levels more quickly than most individuals think. Today, we are introducing the scientifically validated beverage that can assist you in eliminating extra sugar and regaining control over your health. Watch this space to find out how to prepare it right, when to drink it, and why it's so good. Let's begin with the first. Green tea is the first. There's more to green tea than just a hot cup. It is a treatment supported by science that can alter how sugar functions in your body. With 2 calories, nearly 0 grams of protein, 0 grams of fat, and less than 1 gram of carbohydrates, a single cup of sugar-free brewed coffee has essentially no glycemic load and a glycemic index that is very close to 0. Because of this, it never raises blood sugar, which makes it the perfect everyday beverage for Americans with diabetes. Its power, however, comes from a horde of bioactive substances that directly affect organ preservation and blood sugar regulation rather than macronutrients. The main ingredient is the antioxidant epigallocatechin gallate, which accounts for around 60% of the polyphenols in green tea. According to clinical research, EGCG increases insulin sensitivity by 13 to 15%. Assisting your cells in making better utilization of sugar. By reducing inflammatory pathways in muscle and fat tissue, it lowers insulin resistance. It has been demonstrated that consuming 3 to 4 cups per day lowers HbA1c in diabetics by 0.3 to 0.5 percentage points, which is equivalent to certain prescription medication reductions. Although this may not seem like much, the risk of diabetic complications is reduced by over 37% for every 1% decrease in HbA1c. Additionally, each cup contains 2 mg of trace magnesium and 27 mg of potassium. Small but essential levels for nerve stabilization and lowering the frequency of diabetic muscular cramps. About 6% of daily manganese, a mineral that aids enzymes in controlling the metabolism of carbohydrates, comes from green tea. At 0.3 mg per cup, the fluoride concentration promotes dental health, which is essential for diabetics who are at risk for gum infections. These nutrients combine to make a beverage that functions subtly in several systems. After 12 weeks of consistent use, green tea protects the heart's arteries against plaque accumulation by reducing LDL cholesterol by 7 to 10% and raising HDL by roughly 4%. Green tea users really had a 26% decreased risk of heart attacks, according to studies conducted on American populations. Its catechins promote the generation of nitric oxide, which relaxes blood vessels and enhances circulation for vascular health. This lowers blood pressure, which is another unintended consequence of diabetes. Green tea helps the kidneys by reducing oxidative stress in kidney filters, which in turn minimizes protein leakage in urine. For the nerves, by preventing free radical damage, it lessens painful neuropathy. After 3 months of treatment, improvements are observed in roughly 30% of patients. Because catechins prevent fat formation, which is prevalent in diabetics with fatty liver disease, even the liver benefits. Green tea's polyphenols reduce blood sugar rises by 15 to 20% by slowing the conversion of carbohydrates to glucose. With regular use, fasting blood sugar can drop by 10 to 15 mg, DL, which is sufficient to bring a pre-diabetic result back into a safer range. It affects not just sugar but also the lengthy series of harms sugar inflicts on the nerves, arteries, and eyes. For this reason, extensive cohort studies have shown that long-term drinkers have a 33% decreased risk of type 2 diabetes. Gentle brewing is the most effective method for making green tea for diabetics. In 180 milliliters of boiling water at 80 degrees Celsius, add 1 tea bag or 1 teaspoon of loose green tea. For the release of antioxidants without bitterness, steep for only 2 to 3 minutes. While adding milk may decrease the absorption of catechins, adding lemon juice increases it. Therefore, simplicity is ideal. Even artificial sweeteners should be avoided to avoid hidden sugar effects and cravings. Drinking errors are frequent. Delicate catechins are destroyed when green tea is boiled in extremely hot water, 100 degrees. Some people reuse old leaves for hours at a time, which promotes the spread of bacteria. Others consume it without food, which causes the tannins to make them queasy. Because it binds minerals in meals, consuming more than 8 cups per day can result in iron insufficiency, palpitations, stomach discomfort, and insomnia. 3 to 4 cups a day, or roughly 300 to 400 milligrams of catechins, is the recommended daily dose. The dosage was associated with improved vascular benefits and HbA1c. Because it directly lowers post-meal glucose rises, drinking is best done right after meals, particularly lunch and dinner. Because caffeine might cause sleep disturbances in older adults, it is not recommended to drink at night. Although decaffeinated green tea still contains catechins for caffeine-sensitive people, it should be carefully picked because some U.S. versions employ chemical decaffeination, which lowers antioxidants. Precautions are important. Green tea may increase the risk of bleeding when used with warfarin and occasionally raise liver enzymes when taken with statins. Because concentrated catechins may induce stress on weak kidneys, diabetics with kidney problems should limit their intake. People who are anemic or pregnant should exercise caution because of problems with iron absorption. 2. A drink made with apple cider vinegar. Every sip of the apple cider vinegar drink causes changes deep within the body, despite its obvious power. Only 3 calories, nearly no protein, fat, or fiber, and 0.9 grams of acetic acid, the crucial substance that changes the way the body processes sugar, are found in 1 tablespoon. Its glycemic index is 0, in contrast to that of bread or fruit. However, it can reduce the GI of starchy foods like bread or rice by up to 30% when taken with meals. It results in far fewer sugar spikes and a delayed release of glucose. The way acetic acid functions at the cellular level is where the true magic lies. It delays the breakdown of starch by inhibiting the gut's enzymes that break down carbohydrates. Additionally, it triggers the activation of AMPK, the cell's energy switch, which makes muscles extract glucose from the blood. 20 milliliters of apple cider vinegar before meals decreased post-meal glucose by 34% and the following day's fasting blood sugar by 15 to 20 milligrams. Shower DL in clinical investigations with persons with diabetes in the United States. When it comes to insulin resistance, vinegar increases muscle insulin sensitivity by over 19%, increasing the effectiveness of each insulin drop. This results in a 0.5% decrease in HbA1c over weeks, which is sufficient to reduce consequences like kidney damage and neuropathy by over 40%. Let's start to suspect the nutrients that aren't discussed. 11 milligrams of potassium per tablespoon improve nerve conduction and help avoid excruciating cramps. 1 milligram of magnesium, which may seem insignificant, activates insulin pathways by combining with acetic acid. Energy transfer within cells is strengthened by 2 milligrams of phosphorus. Vinegar even contains trace amounts of iron, zinc, and manganese, which improve antioxidant defense, enzyme balance, and red blood cell function. By shielding blood vessels, kidneys, and neurons from oxidative stress, these minerals work in concert to subtly increase the blood sugar lowering effect. Apple cider vinegar increases heart protective HDL by 4% and decreases triglycerides by 9%, while lowering blood pressure by managing sodium better. For the nerves, steadier sugar lessens neuropathy's burning and tingling, which almost 28% of diabetics say has improved. It lowers the risk of chronic renal disease progression by reducing protein leakage in the kidneys. It protects against non-alcoholic fatty liver disease, which is 3 times more common in diabetics, by reducing fat accumulation in the liver. This drink's manipulation of blood sugar curves is what almost raises suspicions. After meals, vinegar flattens the rise in glucose and avoids the late crashes that cause hunger instead of causing erratic peaks. According to studies, this flattening lowers the incidence of heart attack and stroke by 23% by reducing vascular inflammation. Additionally, it promotes endothelial function, which results in better circulation and healthier arteries. Precision is required in preparation. Combine 200 milliliters of lukewarm water with 1 spoonful of raw apple cider vinegar. Boiling water should never be used because heat kills active enzymes. For added antioxidant power, add half a teaspoon of cinnamon or a slice of lemon for vitamin C for optimal glycemic control. Consume it 10 to 15 minutes prior to meals. However, a poor strategy can be detrimental. It burns the throat and erodes tooth enamel when consumed straight. If you take more than 4 tablespoons per day, your potassium levels can drop severely, which can cause irregular heartbeats and muscle weakness. Overdosing also increases the risk of long-term bone loss. If vinegar is combined without supervision, people using insulin sulfonylureas or metformin may have hypoglycemia. People who have severe or chronic renal disease should exercise caution because too much acid aggravates their condition. 2 tablespoons per day is the safest and most efficient regimen for diabetics in the United States. Before lunch and dinner, divide. This yields roughly 1.8 grams of acetic acid. The dose that has been shown to reduce post-meal glucose spike by 1/3. While consuming it in the evening reduces fluctuations in blood sugar, using it in the morning stabilizes fasting blood sugar. However, consuming it late at night on an empty stomach may result in reflux or nausea. Thus, it is always timed with eating. Okra water comes in at number 3. Okra water has a combination of elements that directly affect blood sugar and vascular health, making it one of the most unexpected natural treatments for diabetes control. 1 glass has a very low glycemic index of about 20, with 2 grams of protein, nearly 7 grams of fiber, and less than 3 grams of carbohydrates. This indicates that glucose from okra water reaches the bloodstream gradually, preventing the abrupt spikes that are so hazardous in diabetes. According to studies on type 2 diabetes, fiber, especially mucilage, forms a gel-like coating in the stomach that retains extra glucose and delays its absorption. Reducing post-meal sugar increases by over 25%. Another undiscovered weapon is the mineral makeup of okra water. About 80 milligrams of magnesium, or 20% of daily requirements, are included in each cup. Additionally, this mineral is essential for increasing insulin sensitivity. Diets high in magnesium have been shown to reduce the risk of type 2 diabetes by about 30%. While also lessening seniors' nerve tingling and leg cramps. In addition to magnesium, okra water provides trace levels of calcium, potassium, zinc, and iron. Zinc is associated with improved beta cell activity in the pancreatic cells that release insulin, while potassium promotes improved blood pressure regulation, safeguarding the kidneys and vascular system. Even a small quantity of iron supports endurance and prevents exhaustion by enhancing oxygen transport to muscles. Okra's antioxidant concentration is what sets it apart. Polyphenols, flavonoids, and quercetin, which are abundant in its seeds and skin, counteract oxidative stress within blood vessels. One of the silent killers of diabetes is high oxidative stress, which causes kidney damage, neurological discomfort, and vascular stiffness. According to studies, eating ochre every day can reduce oxidative stress indicators by up to 45%, protecting both large and small blood vessels. Similar to the effects of various first-line diabetes medications, these antioxidants have also been linked to improved HbA1c levels, with reductions averaged 0.8% over 8 weeks in clinical studies. The impact of ochre on the gut microbiota is another underappreciated advantage. Short-chain fatty acids, which improve insulin sensitivity and reduce inflammation, are produced when the soluble fiber ferments in the colon. In addition to stabilizing fasting glucose, this gut-healing quality can cut morning blood sugar spikes by as much as 20%. Okra water lowers the risk of heart attack and stroke by promoting smoother blood flow and reducing the absorption of LDL cholesterol. It lessens protein leakage in the kidneys, delaying the onset of neuropathy. It speeds up the nerve system's conduction and lessens foot burning, a frequent diabetes symptom. It's important to prepare okra water properly. The best way is to cut up 3 fresh okra pods, soak them in 300 milliliters of filtered water at room temperature for the entire night, and then drink it right before breakfast. Steer clear of boiling because heat destroys certain mucilage and antioxidants. While room temperature is ideal for digestion, seniors in the United States frequently refrigerate overnight to make it taste refreshing. Avoid mistakes that alter the glycemic response, such as adding sugar, honey, or lemon juice. Additionally, because it ferments and causes bloating, never soak for longer than 24 hours. Okra water is best consumed in the early, when insulin sensitivity is at its lowest, and on an empty stomach. The safe and efficient dosage is 1 glass each day. Overuse can disrupt the absorption of metformin, induce gastrointestinal distress, or result in kidney stones due to an excess of oxalates. Because okra contains vitamin K, which may lessen the effectiveness of blood thinners like warfarin, those taking these medications need to exercise caution. Large doses should be avoided by pregnant women since they may stimulate the uterus. Because of the potassium and oxalate burden, seniors with kidney disease should speak with their physician. 4. Vegetable juices that have been diluted. Vegetable liquids that have been diluted may appear innocuous, but each sip contains a concoction of nutrients that alter blood sugar levels. A well-balanced glass of bitter gourd, kale, cucumber, celery, or spinach provides consistent energy without sudden bursts. The proteins weigh between 2 and 3 grams, which is modest but sufficient to maintain muscle regeneration and enzyme activity. The surprise is the 3 to 4 grams of fiber, which slows digestion and retains glucose molecules before they spike into the bloodstream. The carbohydrates remain close to 6 to 8 grams. Because its glycemic index stays between 15 and 25, it is among the least harmful beverages for diabetics. The density of minerals is suspiciously high. About 80 to 100 milligrams of magnesium are found in each meal, which provides almost 25% of daily requirements. Additionally, this alone can reduce fasting sugar by 10 to 20% and increase insulin sensitivity by 20%. In addition, 400 milligrams of potassium maintains smooth renal filtration and relaxes arteries. Calcium around 50 milligrams strengthens nerves and muscle contractions, while 1 to 2 milligrams of iron fuels hemoglobin and prevents fatigue. Even trace and zinc levels improve daily glucose control by sharpening the pancreatic storage of insulin. Then, like a secret weapon, the vitamins arrive. By providing 30 to 50 milligrams of vitamin C, which is more than 40% of daily requirements, spinach and kale help to lower oxidative stress on arteries. Beta-carotene from greens and carrots repairs eyesight cells, while vitamin E protects nerve endings and avoids neuropathy. Vitamin K protects the health of the arteries by directing calcium into the bones rather than the arteries. Red blood cells and nerve messages are maintained by folate and Mb vitamins. When combined, they reduce long-term issues that harm the kidneys, brain, and eyes. Antioxidants are therapeutic, not merely ornamental. As molecular cleansers, polyphenols, flavonoids, and chlorophyll reduce inflammatory markers by 30%. 3 months of daily vegetable juice can reduce HbA1c by 0.5 to 0.6%, according to clinical research. Cut post-meal increases by 30 mg dl and fasting glucose by 25 mg dl. These figures indicate a calmer heart rhythm, fewer nerve shocks, and less strain on insulin. The silent controller is fiber. While insoluble fiber moves through the intestines and feeds the bacteria, soluble fiber gels inside the gut and delays the release of glucose. These microorganisms produce substances that lower insulin resistance by 15% to 20%. Additionally, fiber reduces the stress on the kidneys that filter excess fat and sugar by binding cholesterol, lowering LDL and reducing the risk of heart disease by 15%. Improvements in circulation feel suspiciously quick. Nitrates found in greens like spinach and beet leaves are transformed into nitric oxide, which dilates blood vessels. This restores blood flow to the heart, kidneys, and even the legs, where diabetics frequently experience cramping, by lowering systolic blood pressure by 5 to 10 mm of mercury. Improved oxygen supply to tissues is another benefit of higher nitric oxide levels for male vascular health. The pivotal moment is preparation. The finest recipe combines 200 ml water with half a cucumber, 1 celery stick, a thin slice of bitter gourd, a handful of spinach, and a small kale leaf. To preserve the enzymes, it should be consumed at room temperature rather than cold. Avoid making mistakes like combining sugary fruits, utilizing prepackaged juices, or adding too much salt, as they can interfere with pressure control. Results are stronger when they are timed. A glass before breakfast in the morning sets up the body for consistent blood sugar regulation throughout the day. 1 serving is safe, but more than 2 could cause hyperkalemia, which can cause muscle weakness or an irregular heartbeat, especially in kidney patients. Those using insulin or sulfonylureas may get hypoglycemia if they consume too much bitter gourd. Chia seed water is number 5. When those small seeds swell up, chia seed water transforms from a seemingly straightforward beverage into a diabetic powerhouse. Its glycemic index of only 1 indicates that it has almost no direct effect on blood sugar levels. It is among the safest beverages for those with type 2 diabetes just because of that. Chia seeds provide about 4 grams of protein per ounce, which promotes fullness, slows down digestion, and helps diabetics maintain lean muscle, which is something they sometimes struggle to do. Additionally, by enhancing the production of GLP-1 hormones, which postpone stomach emptying, protein lowers post-meal glucose increases. Each ounce contains 12 grams of carbohydrates. Here's the twist, though. Just 1 gram of net carbohydrates remain after 11 of those grams are made up of dietary fiber. According to clinical research, this incredibly high soluble fiber content creates a gel-like layer in the stomach that slows down the absorption of glucose and reduces postprandial blood sugar increases by about 39%. Additionally, fiber increases insulin sensitivity and, when taken daily for 12 weeks, can lower HbA1c by 0.4 to 0.6%. Chia contains omega-3 fatty acids, primarily ALA, 5G, ounce, which lower inflammation that harms insulin receptors. Omega-3s have been shown to protect the heart by reducing triglycerides, improving insulin resistance by roughly 26%, and lowering fasting glucose by 8 to 10 milliliters dl. These good fats lower the incidence of neuropathy by protecting the myelin sheath around nerves. By lowering blood pressure and decreasing protein loss in urine, omega-3 fatty acids help the kidneys halt the onset of diabetic neuropathy. With 179 milligrams per ounce, or 18% of daily requirements, chia seeds are also a good source of calcium. This mineral lessens muscle cramps that diabetics frequently experience at night and aids in nerve communication. At 95 milligrams per ounce, magnesium contributes to insulin signaling and meets 23% of daily requirements. Poor glucose management is closely associated with low magnesium, and chia water helps close that gap. By regulating sodium, reducing the risk of hypertension, and enhancing arterial flexibility, potassium, 115 mg/ounce, promotes vascular health. Together, these minerals lessen the burden on the kidneys and heart, which are particularly susceptible in diabetics. It's also important to note that chia contains antioxidants. Quercetin, caffeic acid, and chlorogenic acid combat oxidative stress, which hastens the development of neuropathy and retinopathy. In human studies, quercetin can lower fasting blood sugar by over 20% and enhances beta cell survival in the pancreas. By reducing inflammatory cytokines, these substances increase vascular suppleness and reduce the risk of thrombosis and stroke. Chia seed water reduces appetite and creates fullness by expanding up to 10 times its size in the stomach, which helps with weight control. For overweight diabetics, losing weight directly increases insulin sensitivity by 15% to 20%. At 2.2 milligrams per ounce, the mild iron level meets 12% of daily requirements and supports hemoglobin, which enhances the transport of oxygen to areas that are compromised by inadequate circulation. At 1.3 milligrams, zinc aids in immunological defense and wound healing, both of which are compromised in diabetics. Additionally, a small amount of iodine may help maintain thyroid equilibrium, which would indirectly enhance metabolism. To prepare it correctly, mix 1 cup of room temperature water with 1 teaspoon of chia seeds. Give it a good stir, then leave it for at least 20 minutes to gel. Squeezing in some lemon juice improves iron absorption and increases vitamin C. Never use hot water because it can destroy sensitive antioxidants. Some people even chill it for an hour to thicken it even more. Chia seed water is best consumed 30 minutes before meals or in the morning before breakfast. This timing lessens the surge from the subsequent meal and lowers fasting blood glucose. 1 to 2 tablespoons, or 10 to 20 grams, of chia seeds is the recommended daily intake. Over 40 grams per day can lead to mineral binding, bloating, and constipation, which can be dangerous, particularly for kidney patients who need to keep an eye on their potassium and phosphorus levels. Because of the omega-3 component, excessive use might potentially thin blood. Therefore, anybody taking aspirin or warfarin should speak with their doctor. Not soaking chia seeds for enough time is a common mistake made by diabetics. Eating them dry can result in intestinal or throat obstructions or choking. Adding sugar, honey, or sweetened liquids negates the low GI benefit, which is another error. The best option is to keep it simple with lemon or water. To assist others in managing their blood sugar, please like, subscribe, and share if you find this useful. Try this beverage. See how your health improves, and check back soon for more transformative advice.